Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, I speak with Dr. Donald Warne, co-director of the Johns Hopkins Center for Indigenous Health and a member of the Oglala Lakota tribe, about the grand opening of the Great Plains Hub in Rapid City, South Dakota, and some of the life-saving public health research projects that are launching there. Let's listen. Dr. Donald Warne, thank you so much for coming back to Public Health on Call. And today you're here to talk to us about the grand opening of the Great Plains Hub for the Johns Hopkins Center for Indigenous Health. Can you tell us a little bit about the hub and what it's hoping to accomplish?
Yeah, our Center for Indigenous Health, of course, is housed at the Bloomberg School of Public Health in Baltimore. But of our 350 plus employees, only about 20 are located in Baltimore. So we have hubs throughout the country, primarily located near the tribal populations that we work with. So we have a Southwest hub with multiple sites in New Mexico and Arizona, and a Great Lakes hub located in Duluth, Minnesota. And our brand new hub is the Great Plains Hub located in Rapid City, South Dakota. And the reason we have these hubs is that much of the research that we do is community-based. And we recognize that to do effective community engagement, that can't be done from a computer in Baltimore. It has to really be with the communities. So we've been able to be very successful with pursuing and acquiring significant research grants and other resources to engage communities and to provide community-driven research, in which we're also hiring community members to work with us. So we're very excited about the emerging opportunities in the Great Plains.
So tell us a little bit about the actual hub itself. I know you did a grand opening recently. What does it look like? What goes on inside?
Yeah, we had our grand opening on September 20th. We're working in close collaboration with one of the larger health research programs in South Dakota called Avera Research Institute. And they have a building in Rapid City. And one of our projects that recently got funded through the Bristol-Myers Squibb Foundation is in close collaboration with them. It's a lung cancer research project. So basically, it's office space for now that we're renting in collaboration with that partner, Avera Research Institute. And we're planning on growth. And fortunately, in that building, there's room for growth. And it makes a lot of sense to be in close collaboration and co-located with our partners, because we had a research convening ahead of the grand opening in which we invited and had about 14 or 15 stakeholder groups and research programs join us to identify where we could collaborate, because we don't want to go in there and be seen as a competitor for research resources. We want to be seen as a resource and a collaborator. So just very excited about our opportunities in Rapid City.
Yeah, I wanted to ask about that too. There is some significance to the fact that this is based in Rapid City, South Dakota. Can you talk a little about that?
Yeah, in Lakota, we call Rapid City, or actually, Rapid City is called Mini Luzahan, which literally means fast water or rapid creek. But the Black Hills, Pa Sapa, is our homelands, and the Black Hills are just beautiful. And Rapid City is located at the eastern edge of the Black Hills. And this is also a site where our people would spend the winter because it was protected from the elements. Of course, in the Great Plains, the winters can be pretty harsh. So our people were nomadic. We did not have permanent structures. So we lived on the plains during the good weather months. There's plenty of places to go to for hunting and establishing villages and convening together as the Ocheti Shakoi, which is the 7 council fires of our tribal groups. And then in the winters, we would go into the hills to be protected from the elements. We call the Black Hills the heart of everything that is. And it's seen as a very sacred place, very protective for us, and provided us shelter. So being here in our homelands is just wonderful. And then just geographically, if you look at the maps of North Dakota, South Dakota, and Montana, Rapid City is kind of the largest city right in the middle of all of that. So it's this wonderful location for historical and cultural purposes, as well as just simple logistical purposes.
I've heard you use the word convening several times, both in describing the actual physical space and the geographic space, and that seems to be a very important aspect of this work. Can you talk about that?
Yes, and it's so important from, again, historical and cultural perspective to come together and to share a meal together and to talk with each other and get to know each other. And it's very different than the modern scientific arena, where quite often we have collaborators that are co-investigators, perhaps, and may or may not meet them in person, may have, Zoom discussions or telephone calls, but we don't really know each other. And that's really not a culturally appropriate way to have partners and collaborators. So in these settings, we get to know each other better. And there's a lot of humor and laughter and understanding of where we come from. When we introduce ourselves in our traditional languages, we also talk about our families and who our parents and grandparents are, and what clan systems or extended family systems that we have. And we identify those connections. And it's really a beautiful process, because then suddenly you might realize one of the co-investigators is a relative or a relative of a relative. And having that making of relatives and being a good relative is part of our culture. So when we are wanting to engage communities, we can't just take the modern scientific approach and look at collaborators as random individuals or communities as laboratories from which we acquire data. No, these are partners. And when we're collaborating and convening, that's really in a traditional cultural way, but it also, in truth, strengthens the science because we do better work.
And tell us a little bit about this work. You mentioned previously lung cancer research. What else is in the works?
Well, we have several projects going. And when I started at Johns Hopkins just a little over 2 years ago, the 5-year plan was to have a Great Plains hub. And the good news is every grant we applied for, we acquired. The bad news is that every grant we applied for, we acquired, so we had to build up very quickly. So I had mentioned the lung cancer research project. So I'll talk about a few of them just very briefly. But unfortunately, in the Northern Great Plains, we have the highest rates of smoking in the country. And in some of our reservation communities, the adult smoking rates are well over 50%. So it's almost like going back in time, like in the 1950s when everyone smoked cigarettes. Of course, nationally, that's now below 20% for adults, but still very high rates of cigarette smoking. And the other challenge is that there's these wonderful new technologies to do lung cancer screening, but it requires a specific type of CT scanner. And most IHS sites, Indian Health Service sites, don't have access to that technology. So the result is we have the highest risk for lung cancer, but among the lowest access to screening. Therefore, we're diagnosing people with lung cancer at a much later stage of disease when people are symptomatic. So not surprisingly, we also have then worse outcomes, so much higher mortality rates as a result. So this project has several components. One is a lung cancer navigation program, but not just navigation for screening. It's really screening through for survivorship and having navigators who can assist the patients through that process. We also are doing a health policy research study because South Dakota recently passed Medicaid expansion just a little over a year ago. So we're going to look at the impact of Medicaid expansion on American Indian lung cancer outcomes in South Dakota. And then the third, I think the reason we have such high rates of smoking is that we've had traditional tobacco, which is very different than commercial tobacco. It's really a blend of medicinal herbs, primarily red willow. And unfortunately, a lot of people are using cigarette tobacco in ceremony and with the sacred pipe and praying with it. And I know a lot of our medicine men and traditional healers don't like that because we're basically using the colonizer's poison as a traditional medicine, and it's obviously not appropriate. So there's never been like a position statement generated on that from the traditional healers. So the purpose of this part of the study is to do key informant interviews with traditional healers and elders and knowledge keepers and to get their perspectives on this. And then ultimately the goal is to have a position statement from our Lakota and Dakota leaders to advocate for traditional tobacco, which is medicinal, but against commercial tobacco, which is a poison. So that's just one of the projects. I don't know, if you want, I could mention one or two others if you wanted to hear any other projects.
Yes, please tell us more.
Yeah, so another big challenge we face is diabetes. We have much higher rates of type 2 diabetes among American Indians than most other races or ethnicities. And that's true here in the Great Plains. Fortunately, through our center, we have had a program called Together Overcoming Diabetes for quite a number of years. And the Together Overcoming Diabetes program, the framework includes an adult with type 2 diabetes and a youth family member. And the youth family member could be up to age 25, so it's not necessarily just young children. But the idea is to have a holistic wellness curriculum that both the person with diabetes and the youth family member go through the curriculum. But it's not just the typical diet and exercise that you'd find in a diabetes education handbook, for example. It also includes holistic wellness and an understanding of some of our health challenges, including things like historical trauma. But even more importantly, what are the cultural practices that can help us to overcome historical trauma? So there's lessons that are inclusive of traditional ceremony, traditional culture, traditional foods, traditional physical activity and practices, but also things like stress management and how to deal with problems and how to confront stress and how to be mindful of eating. A lot of people, when they're stressed, eat more, and it's really bad when you have diabetes. So this has been shown to be very effective. And the Together Overcoming Diabetes started in Arizona with a couple of tribes there, and they found statistically significant reductions in blood sugar and weight, and it was just remarkable outcomes. So then that program was culturally adapted to the Ojibwe population and housed out of our Great Lakes hub in Minnesota. And they found the same results, significant reductions in blood sugar and in weight or body mass index. So this project, we are in the initial phase in which we are culturally adapting the Together Overcoming Diabetes curriculum to the Lakota population. And to do that, we're doing focus groups with key groups to get input on how to best modify the curriculum to make it more Lakota specific and regionally specific. And I'll just say briefly, we've already had a couple of focus groups, one with traditional healers and elders, and another focus group of adults with diabetes or pre-diabetes. And the input we're getting is just tremendous. It's really remarkable, the ideas that are being generated on how to modify this curriculum. And I'm very excited about it because through NIH, this is a NIH-funded study, if we show proof of concept and success in Rapid City, then there's the opportunity to build it out and implement that program in tribal populations, including Pine Ridge, Rosebud, and Cheyenne River, which are very close to the city of Rapid City. There's other studies too, but I'll go ahead and pause there.
We've talked before about this in all of this work with the Center for Indigenous Health and in all of your hubs. You know, you bring scientific rigor, you bring public health framework to do very important research for these life-saving things you've mentioned, smoking and lung cancer and diabetes. But there's something that is unique to Indigenous public health, and that is this cultural strengths piece that really ties everything together. Tell us about that.
Yeah, when we think about health challenges and cross-cultural health and populations, we tend to focus on the disparities. And of course, we do have disparities. We have higher rates of chronic disease, for example, whether it's cancer, diabetes, heart disease, or otherwise. But we also have unique interventions and unique approaches that need to be maximized and need to be implemented into the health programming. And from a cultural perspective, holistic wellness is good for all of us. And we know even people with diabetes have higher rates of depression, but we don't do a very good job of addressing that, to be quite honest. I'm a physician and I've worked in communities with high rates of diabetes, and I was even a certified diabetes educator as part of my practice many years ago. And just honestly, modern medicine doesn't think holistically. We tend to have a very reductionist approach to health science, and we think about the molecular basis for insulin resistance. And that's all well and good, but that's occurring within a human who also has spiritual and cultural and mental and emotional components to who they are. And the traditional approaches are inclusive of those elements. And if we're going to be effective, we have to be holistic and we have to be culturally relevant. So that's one of the reasons why our center is not focused just on research, but also workforce development and education. And what we're really pleased with is the many hundreds now of Indigenous students who have pursued master's degrees and doctoral degrees in public health. Because in our populations, the messengers really matter. And if we have the best trained, most highly qualified non-Indigenous researchers, they're not necessarily going to engage the communities in a culturally appropriate manner. And it's not that they're not good scientists, but if they're not a trusted entity, they're not going to be able to engage the community. So, for example, as a Lakota researcher, I know the protocols, and I can actually start a focus group or a research convening with a Lakota prayer. I can speak in Lakota. It's sincere. I'm not just memorizing words. And it comes from my heart. It comes from my spirit. It comes from the core of who I am culturally. And that really matters in building trust. So we have to have diversity in the research workforce. And that's one thing I'm really pleased with our center, is that we're advancing health leadership to the highest level among Indigenous peoples, in addition to conducting meaningful research.
Well, this is very exciting because you now have a physical space to be doing all of this work. You've got your grants. Thank you so much, Dr. Warne, for joining us on Public Health on Call.
Very happy to be here. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.